Private hospitals have been trying to stem a hemorrhage of nurses, but it's been a losing battle. The Private Hospitals Association says 4 out of every 10 nurses working in private hospitals have already resigned since the pandemic began. Many private hospitals are now using unlicensed health workers as a stopgap measure.
We are making use of the underboard nurses, unregistered nurses, and the midwives, and the nursing attendants.
Private hospitals have been hoping to tap into the 5,000 newly licensed nurses who should be joining the workforce this year. But there are still not enough applicants. Salaries of private hospital nurses are almost just half of salaries of those in public hospitals. Degrano says private hospitals are struggling to make do with unlicensed
As long
workers.
as you have one registered nurse that can supervise them, then that will be okay.
Private nurses groups have been threatening mass actions. Under Bayanihan, 29 billion pesos were set aside to give health workers a special risk allowance of 5,000 pesos per month. But 8 months into 2021, many health workers say they have yet to receive the promised benefits.
Taliwas po sa mga sinasabi ni Secretary Doke na yan daw po ay downloaded na. Kalukuhan po yun.
The health department says they already released 7 billion for special risk allowances, but Dr. Degrano says the money may be tied up in the regional level.
Some of them require that the money has to pass through the local government units, and then the local government units will again issue memorandum of agreement, etc.
Lumia says if the government does not find a way to either raise the minimum salaries of private nurses or give their special risk allowances, then a mass resignation will always be an option. I'm Jabob Lazaro and we are One News.